Hello friends, myself Sapna Rajput and today I discuss a respiratory infection because respiratory infection is a very common condition we can see in the pediatric, geriatric or youngster. So today we discuss respiratory infection in that first one tonsillitis. So let's we see the tonsillitis. First one in that tonsillitis definition, it is the inflammation of tonsils. That means tonsillitis means inflammation of the tonsils. In the types, acute tonsillitis and chronic tonsillitis. Tonsillitis about in that two types, acute and chronic. If tonsillitis occurring for short duration, so we can call the acute tonsillitis, and that tonsillitis is occur in our body for the long term duration, so we can call the chronic tonsillitis. The next one, first we discuss the acute tonsillitis. So in that definition, it is the acute inflammation of tonsils. It is mainly disease of childhood. So tonsillitis, acute tonsillitis is especially seen in the childhood age. So we can able to see in the pediatrics most this disease condition acute tonsillitis and inflammation of the tonsils. Etiology, that means causes of acute tonsillitis, primary infection of the tonsils, upper respiratory tract infection, poor dental hygiene, poor nutrition, and organisms such as streptococcus, staphylococcus, and pneumococcus. So in that causes for the acute tonsillitis, if person are primary infection of the tonsils, then upper respiratory tract infection, poor dental hygiene, those who are not maintain a proper dental hygiene like not use the proper toothbrush or toothpaste, so that people included in that, then poor nutrition, those we can see acute tonsillitis in especially in pediatrics. So those pediatrics who are having a disease condition with the like anemia, then calcium deficiency, that type of conditions, then organisms such as streptococcus, staphylococcus, and pneumococcus, this type of bacterial infection already present in the pediatrics. So these are the causes for the acute tonsillitis. The next one, pathophysiology. In that, due to the etiological factor, we can see in the etiology, so leads to inflammation of tonsils, leads to a hyperemia and edema, and leads to a conversion of lymphoid follicles into a small abscess. So due to the etiological factor, which type of etiological factor we can see in the etiology, like a poor nutrition, poor dental hygiene, infection like staphylococcus, streptococcus, or pneumococcus, primary infection. So these all things is etiological reason. Due to that, inflammation of the tonsils, that means the inflammation occur in our tonsils, and that leads to a hyperemia and edema. Hyperemia, that means an excess of blood in the vessel supplying an organ or other part of the body, and edema, that means the swelling that leads to a conversion of lymphoid follicle into a small abscess. That means lymphoid follicles are converted into a small abscess. Then, not especially in that, along with tonsils, if the oropharyngeal mucosa is infected, that called catheteral tonsillitis, and when the inflammatory exudates collect in the tonsil crypts, there is a presence of white spot on the inflamed tonsillar surface. That condition is called follicular tonsillitis. So here two types of tonsillitis, catheteral tonsillitis and follicular tonsillitis. Catheteral means tonsils of the oropharyngeal mucosa is infected, called the catheteral tonsillitis, and when the inflammatory exudates collect in the tonsil crypts, there is a presence of white spots inflamed tonsillar surface. That condition is called the follicular tonsillitis. Next, we discuss the clinical manifestations of the acute tonsillitis. So, in that, throat pain, difficulty in swallowing, otalgia, anorexia, fever, body ache, malaise, and lymphadenopathy or cervical lymph node. So, in that, lymphadenopathy, that means disease affecting the lymph node, and malaise, backache, fever, anorexia, otalgia, that means pain in ear, anorexia means lack of appetite, throat pain, and difficulty in swallowing. So these all things we can see in the difficulty in swallowing is a terminology for the dysphagia. So all things we see in the with the acute tonsillitis. The next one, management. In that medical management, provide appropriate antibiotics, mild analgesics, saline throat irrigation, and maximum bed rest. So that is the medical management for the acute tonsillitis. And surgical management, if we are not treat with the medical management tonsillitis, so then must be necessary a surgical management. So surgical management in that tonsillectomy, it's a one type of surgery for the tonsillitis. So in that tonsillectomy, we can cut the tonsils of not properly, but which are the part are infected under the tonsillitis, that part we cut in the surgical management, and that is called the tonsillectomy. And in that medical management, provide appropriate antibiotics for the prevent infection, analgesics we give for the pain relief, saline throat irrigations for the prevent the scaring of throat, and maximum bed rest because patient feel the comfort. Okay, the next condition is the chronic tonsillitis, because we can see in the first condition tonsillitis in the two types, acute and chronic. First we discuss the acute tonsillitis and now we discuss the chronic tonsillitis. So in that first one definition, it is the chronic inflammation of tonsils. So in that acute inflammation of tonsils, and chronic inflammation of tonsil, that means the long term duration. And clinical manifestation is a sore throat, unpleasant taste, dysphagia, and halitosis. Halitosis is a technical term of the bad breath. Then dysphagia and unpleasant taste and sore throat. The next one, investigation, HCPEC culture and sensitivity test. So for the chronic tonsillitis, we done the test like a culture and sensitivity test. The next condition and management is same like acute tonsillitis. In that rhinitis. So rhinitis in that first one definition, it is the inflammation of mucous membrane of the nose. So rhinitis is the inflammation of the mucous membrane of our nose, and causes for that virus, bacteria, fungi, structural deformity, neoplasm, then chronic use of nasal decongestants and use of cocaine. So in that causes, we can see first three primary basic causes: virus, bacterial, fungal infection that also affect the mucous membrane of our nose. Then structural deformity. Structural deformity, that means our nasal septum or nose anatomy are deformity due to the any accidental injury or due to the congenital. Congenital means the by birth. Then neoplasma, chronic use of nasal decongestant and use of cocaine, that also the cause of the rhinitis. The next one, types of rhinitis. In that here two types, allergic rhinitis and non-allergic rhinitis. So first we discuss the allergic rhinitis. In that it is the reaction of nasal mucosa to the specific allergen. It may be caused by allergic pollen from trees, flower or gases. So in that allergic rhinitis, it is the reaction of nasal mucosa to the specific allergen, like may be caused by allergic pollen from the trees, flower and gases. But allergy is a very different in the every individual person, because it's depend on our immune system, then sensitivity of our skin, sensitivity of our body. So allergy is, we can see in the different in every individuals. Then second one is a non-allergic rhinitis. So it is caused by the virus that invade the upper respiratory tract. It is spread by airborne droplets sprayed emitted by the infected person by breathing, sneezing or coughing. So second one in that non-allergic rhinitis is caused by the virus invade the upper respiratory tract, but it is the spread by airborne, that means the droplet infection, infected person by breathing, sneezing or coughing. The next one, we can see the pathophysiology of the rhinitis. In that, due to the etiological factor, the mucous membrane lining the nasal passage become inflamed, congested and edematous, leads to block the nasal opening, leads to mucus is a discharge from the nostrils. So due to the etiological factor, we can see like fungi, bacteria, then viruses, and leads to the mucous membrane lining the nasal passage become inflamed. So nasal passage is inflamed, congested means very narrow, and edematous means swelling. Due to that, blocks the nasal opening. So obviously when congested or edematous nasal passage so block the nasal opening and we are not able to take a proper breath, and leads to last we can able to see a mucosal is discharged from the nostrils. The next one, clinical manifestation, in that first one allergic and second one non-allergic. So rhinitis in that two types, allergic and non-allergic. So in that allergic, nasal congestion, sneezing, watery itchy eye and nose, altered sense of smell, thin watery nasal discharge and headache. So in that allergic type, we can able to see nasal congestion, narrowing the nasal passage, sneezing, watery itchy eyes and nose, because our nose and eyes are also connected with our eyes is also connected with our nose, because that all things is a sense organ of our body, and alters sense of smell, thin watery nasal discharge and headache. Then in that non-allergic types, tickling, irrigation, dryness of nose, nasal obstruction, elevated temperature and malaise. Tickling means mild itching or discomfort of part of the body, dryness of nose, nasal obstruction and elevated temperature and malaise, that all things we can able to see in the non-allergic type. The next one, diagnostic evaluation and investigation for the rhinitis. In this history collection and physical examination, both is very important. In that history collection we collect the data of the patient, like identification data, family history, socio-economic history, hygiene condition of the patient, that all things past, present, medical history, surgical history. So this all things we collect in the history collection. And second one, physical examination, in that we perform the head to toe assessment of the patient. The next one, management, in that first one, medical management. So for the rhinitis, first one, medical management, provide rest, provide more fluid intake and proper diet, provide antipyretic medication, provide corticosteroids and provide decongestants. So provide rest, because rest is more important in this respiratory infections patient, because they are not able to take a proper breath, and very much difficulty, breathing difficulty produce in that type of patient. So we provide the comfortable position to the patient, like a cardiac position, Fowler's position, and provide the more rest. Then provide more fluid intake to the proper diet, that is also important thing, and provide antipyretic medication because relieve the temperature of the patient, provide corticosteroids, induce the sleep in the patient, and provide the decongestants, because patient nasal passage is very narrowing, so for that we provide the decongestants. The next one, nursing management. So nursing management, in that patient should avoid the allergens and irritants. Saline nasal spray help for the softening of secretion. The next one, teach the patient about use of medication and nasal drops. Instruct the patient to blow the nose before applying medication, steam inhalation and bed rest. So in that nursing management, patient should avoid allergen and irrigations, because in that two types of patient we can see in the allergen and non irritants, both are included in the this type of infection. Then saline nasal spray help for the softening of secretion, so provide the saline spray. Then teach the patient about the medication and nasal drops, like take the medication in time to time, don't miss any time to take any medications like antipyretic. And before applying the medications, instruct the patient to blow the nose before applying the medications. So blow the nose before the applying medication. The next one, steam inhalation, provide the steam inhalation. Steam inhalation is a very important thing in every respiratory infection patient, because it's a natural management of the respiratory infection, and steam inhalation is a very effective. management, and bed rest. Then complication: pharyngitis, sinusitis, laryngitis, bronchitis, and pneumonia. Pharyngitis, that means inflammation of pharynx. Sinusitis, that inflammation of sinus. Laryngitis means inflammation of the larynx. Bronchitis means inflammation of the bronchus. And pneumonia. Pneumonia is one type of disease condition we produce in the respiratory system due to this type of causes. So it is the complication related with the rhinitis. The next one we discuss the sinusitis. So in that sinusitis, first one we discuss definition. It is defined as the inflammation of the sinus mucosa. In most cases, the maxillary sinus involved in all of the sinus are involved. It is the known as pensinusitis. So define the inflammation of the sinus mucosa. In most cases, the maxillary sinus involved in the all type of sinuses or sinus infections, and it is known as pensinusitis. And in here, two types are present: acute sinusitis and chronic sinusitis. So in that, acute means first we discuss with you for the short duration, and chronic means for the long term duration. So first we discuss the acute sinusitis. In that first one definition, it is an acute inflammation of the sinus mucosa. That means a acute short term duration of the inflammation in the sinus mucosa, and causes for that rhinitis, dental infection, tonsillitis, deviated nasal septums, nasal polyps, bacterial infection, and benign tumor. So that type of causes responsible for the acute sinusitis like rhinitis, then dental infection, tonsillitis, deviated nasal septum. Deviated nasal septums is a condition in which the nasal septums, the bone and cartilage that divided in the nasal cavity of the nasal in the half. Then nasal polyps. Nasal polyps is a painless benign growth in the lining of the nose, and bacterial infection, and this type of causes is responsible for the acute sinusitis. Then second one, clinical manifestation, that means sign and symptoms we can able to see in the sinusitis. Acute sinusitis: malaise, body ache, fever with the chill, pain over sinus area, and pleural and nasal discharge. Pleural and nasal discharge is a very common in the respiratory infection, and in that especially acute sinusitis. Then pain over the sinus area because sinus area are inflamed. Then fever with the chill, body ache, and malaise. Then investigation test for this acute sinusitis: history collection, physical examination, and x-ray. History collection and physical examination I discussed with you before. Take the full history of the patient and perform the head to toe assessment of the patient, and collect the x-ray of the chest, because chest x-ray is we are able to find out the exactly problem which part are exactly affected. Then second one condition is the chronic sinusitis. This is the mucous membrane lining of the sinus become thickened from prolonged and repeated irrigation and infection. So the mucous membrane lining of sinus become a thickened and from prolonged and repeated irrigation and infection, that called the chronic sinusitis. We are seeing the acute sinusitis inflamed of the mucous membrane, but that condition is very repeatedly we can see in the one person, so that is the chronic sinusitis. And clinical manifestation for that: chronic pleural and nasal discharge, chronic cough, loss of ability to smell, epistaxis, dryness of throat, fever, and tenderness of sinus. So this type of sign and symptoms we are able to see in this chronic sinusitis patient. Chronic pleural and nasal discharge, that is very common. Chronic cough, loss of ability to smell. Patient are not able to smell of any substances to properly. Then epistaxis. The next one, fever and dryness of throat and tenderness of the sinus. The next we discuss the management for the sinusitis. In that first one, medical management, provide the antibiotics like azithromycin. Azithromycin is a very common medication we provide in every patient like a respiratory infections. Then antipyretic to reduce the temperature. Then analgesics to relieve the pain, and enteral irrigation. The next one, surgical management. In that functional endoscopic sinus surgery, Cadwell IUC procedure, and external sphenoethmoidectomy. So these all things included in the surgical management for the sinusitis patient. So Cadwell IUC procedure is one type of procedure performed in the sinus patient. Then external sphenoidography, that means we remove the sphenoethmoidobone in the this patient, and functional endoscopic sinus surgery. So these all things sphenoethmoidectomy, like an operation to remove diseased tissue from the sphenoid and ethmoid sinuses. So this all surgery we perform in this patient. And in that medical management, enteral irrigation are involved. So enteral irrigation, that means enteral lavage, is a surgical procedure in which a cannula is inserted into the opening of the maxillary sinus via the inferior meters to allow irrigation and drainage of the sinuses. So that is called the enteral irrigation. Now let's we see the nursing management for the sinusitis. In that, instruct the patient about the method of sinus drainage, increase the fluid intake, provide comfortable position, provide psychological support, monitor the vital signs, provide appropriate medication at the right time, instruct the patient to take a steam inhalation. So these are things included in the nursing management for the sinusitis patients. So first, instruct the patient of proper method about the sinus drainages, increase the fluid intake, then provide comfortable position. I discussed before with you. Comfortable position is a very important thing. We provide the like a cardiac position, Fowler's position, because patient able to take a breath very properly and very easily. Then provide psychological support. So many peoples are very psychologically affected, like in this type of minor condition. So those who are affected with this type of condition with mental status, so we provide the psychological support, like try to reduce the anxiety, we try to reduce the fear, and we provide the more education related to the disease condition to the patient. Then monitor the vital signs, because this type of things in vital signs is a very important thing. So regular interval we check the vital signs, in especially the breathing rate is a very important in that condition. So we monitor vital signs, then provide appropriate medication at the right time. So provide the medication to the patient at the right time, and instruct the patient to take a steam inhalation. First, already I will discuss with you, steam inhalation is very natural and it's a very effective management for this type of all respiratory infections. So this management is for the sinusitis patient. In this image, we are able to see the patient with the respiratory disorders, and doctors provide the management to that patients and provide which type of position to the patients. So today we discuss in the respiratory infection in these three conditions: tonsillitis, then rhinitis and sinusitis. So these all three conditions are very common with the respiratory infections. Thank you so much for the watching.